Imagine that you or a loved one have been diagnosed with a terminal illness. If it's a loved one that you're watching, you've seen them go through therapy and it hasn't worked, and they're now in the final stages of their life. They are in pain, they're losing function of their body, and eventually they're losing their mind and they don't remember anything. It's not right that people have to suffer at the end of their life. I work as a nurse in the hospital, and I frequently work with patients that are actively dying, and not only does the patient need support, so does the family. Unfortunately, a lot of hospice or palliative care programs are effective, however, the patients still are suffering at the end of their life. So today I'm going to be talking about physician-assisted suicide and how it should be legalized for terminally ill patients. However, they need to be mentally competent enough to be able to make their own end-of-life care. So today, I'm not going to be trying to persuade anybody to personally use physician-assisted suicide. However, I would like to legalize it so that other people are allowed to choose this option if they wanted to. So I'm going to be talking about the differences between physician-assisted suicide and euthanasia, as well as the legalization process, and to finish up social media examples. So the definition of physician-assisted suicide is simply when doctors provide the patient with the means to end his or her own life without being directly involved with the patient's death. Euthanasia, on the other hand, is when the physician actually administers a lethal dose of medication to kill the patient. So an example of physician-assisted suicide would be the physician just giving the prescription, usually for a barbiturate, which is a central nervous system depressant, and the patient decides when and how they're going to take this medication. On the other hand, euthanasia, there's two kinds. Active euthanasia is when that lethal injection is administered by the physician and the patient dies, and passive euthanasia is when you're allowing the patient to die by withholding treatment. And this treatment could be dialysis or chemotherapy or CPR, or even just not giving tube feeding, which would be an artificial nutrition. So we're not going to be talking about euthanasia because we're strictly talking about the legalization process for physician-assisted suicide only. And now the ethics and the pros of this physician-assisted suicide. And these are only for people that meet the guidelines and the safeguards that are in place. So autonomy, that is a word that means to rule or law oneself, which is essentially the ability to make one's own decision and the right to self-determination. So you get to decide how and when you're going to die if that's the situation that you are in. So a patient's autonomy is very important. There's also a lot of compassion and respect for allowing someone to do as they wish, especially when it's their own life. They're not harming anybody else. You're respecting their decision. And then beneficence is an ethical principle that just means doing the greatest good possible. When someone has a terminal illness, there is not much good that needs to be done. And at the end, it's just suffering at the end. No matter how they're suffering, they are still uncomfortable. And their life is prolonged unnecessarily. So why are you going to keep letting that person live if it's not doing any good at all? So now that we know a little bit about physician-assisted suicide, the legalization process. The federal government, the Supreme Court actually ruled against physician-assisted suicide, but each state has the ability to determine its own legal stance of physician-assisted suicide. So the first state that was legalized physician-assisted suicide is Oregon's, with Oregon's Death with Dignity Act that was passed in 1997. There are safeguards and guidelines in place. A couple are that you need to be an Oregon resident. A physician needs to have the license in Oregon to prescribe this medication. The patient needs to be fully educated and voluntary. Request needs to be made, 2 oral requests 15 days apart, and 1 written request that's 2 days apart from that written request. A couple more things are shown. There cannot be any reason for coercion. There's psychological counseling if the physician decides that there is a possibility that they might not be mentally competent, and it allows cancellation at any time during this procedure. And even though it is legalized in Oregon and has been for the last 11 years, it's not used as much as you would think it would be. Only about 1 in 1,000 dying people in Oregon use physician-assisted suicide, which ends up being only 0.2%. And in 2008, 31,000 people died in Oregon, and only 60 from physician-assisted suicide. I do have a graph. The gray bar shows the amount of prescriptions that were given out according to the Physician-Assisted Suicide Act, Death with Dignity. And the black bars show how many people actually used the prescription and passed away. So as you can see, there is an upward trend. 2008 is the largest, but it was only 88 people that asked for a prescription and 60 people only used that medication. So the numbers really aren't astronomical. Now, in addition to Oregon, Washington State became legalized in 2008, and the third and last state that's legalized is Montana in 2009. The Supreme Court ruled that there is nothing in the state law that prohibited a physician from honoring a terminally ill, mentally competent patient by prescribing medications to hasten their own death. So New Jersey's involvement with physician-assisted suicide. Coming along, September 2012, a bill was initiated and brought to the Assembly, and the next month, October 2012, the bill was moved to the Senate, and this February 2013, it was advanced to the Assembly of Senate Health, so it's still actively in the process, and if it does come a time when New Jersey residents are asked to vote on whether a bill should be accepted and made a law with physician-assisted suicide, I hope this speech helps to educate everybody in helping make other people's choice with death and dying a reality. And then to finish up, I'll talk about some social media examples. A big infamous name would be Dr. Jack Kowalski, who is an advocate for physician-assisted suicide. He helped 130 people use physician-assisted suicide in order to end their own life. He made a machine which actually gave the patient the ability to push the button, and that administered the lethal dose of medication. First would be a narcotic, which would make the patient unconscious, and then next potassium chloride would go in, and that would actually stop the heart. His first patient that he used this on was in 1989, and then in 1998, he actually televised one of these mercy killings, as you would call it, and instead of the patient actually pushing the button, he administered the lethal dose of medication. And when this videotape was aired on 60 Minutes in 1998, he was convicted of second-degree murder and sent to jail that year. He was released in 2007, and then he actually died recently in 2011. So in 2011, it sparked a lot more debate and thought on physician-assisted suicide. There was a movie, How to Die in Oregon. It was a film in 2011 that was nominated for an Emmy, and it's people that were making the ultimate decision to participate in physician-assisted suicide and all their trials and tribulations in that decision-making process. There's the Hemlock Society, which is actually merged and become Compassionate Choices, which they have an organization that can be found online. And then Death and Dignity National Center, which is a nonprofit organization made in 1993 that assists people that are interested in this, as well as they really advocate the legal process in order to continue to fight for the legalization in all 50 states. So to finish up and to recap, physician-assisted suicide, it's not euthanasia, it's different. And there are 3 states that have legalized physician-assisted suicide. We have Oregon, Washington State, and Montana. And I personally believe that people should have the ability and the autonomy to make their own decisions regarding their own life, or in this case, in their own death process. If you had the chance to vote on a Death with Dignity Act, would you vote to allow people to choose how and when they wanted to die? Just something to think about.